Hi guys, in today's video I'm going to share with you all you need to know about diabetes. Diabetes simply means when the body is unable to regulate its blood sugar level. Diabetes is classified into two major types. We have diabetes insipidus and diabetes mellitus. In today's video I'm going to be talking about diabetes mellitus. Diabetes mellitus is further divided into two types. We have type 1 diabetes and type 2 diabetes. Now, before I dive into what type 2 and type 1 diabetes is all about, I want us to know how the body normally regulates its blood sugar level. When a healthy individual consumes food high in carbohydrates, it passes through the normal digestive processes, goes into the small intestine where it is digested and broken down into simple sugar, and glucose is released into the bloodstream. The body detects that the blood glucose level is rising and stimulates the pancreas, which is an organ that is located just below the stomach, to secrete insulin. When the pancreas secretes insulin into the bloodstream, insulin travels alongside with the blood glucose towards the body cells, muscle cells, that requires those glucose to function. When it gets to the muscle cells, insulin serves as the key to the gate of the muscle cells. It unlocks the gate of the muscle cells and allows glucose to move into the muscle cells. And then we have the energy that we need to function in our daily activities. What happens in type 1 diabetes mellitus? In type 1 diabetes mellitus, there is no insulin produced at all. Why? Because the body has destroyed the beta cells which secrete insulin. This type of diabetes mellitus is also known as insulin-dependent diabetes mellitus. It accounts in about 10% cases of diabetes. It is common in ages below 40 and is the most common type of diabetes in childhood. It is also known as autoimmune system problem because the body destroys its own cell. Now, what happened to this individual when they consume food high in carbohydrates, especially when it is not diagnosed? So when they consume food high in carbohydrate, of course, it passes through the normal processes of digestion, and glucose is released normally into the bloodstream. And because the body cannot produce insulin to regulate this blood glucose level, the body tries to eliminate this excess glucose through the kidneys, which is why people with type 1 diabetes mellitus, they urinate a lot, they use the toilet enough. Frequent urination, that's what it's called. And now, because the kidney is trying to filter this glucose, it uses a lot of fluid, which is why they are thirsty and dehydrated. Also, you know that bacteria thrive well in glucose because the blood has a lot of glucose in it. When they have a cut or a wound, it doesn't go easily. It's called delayed wound healing. They have delayed wound healing. And then this glucose also accumulates in the fluid that is in the lens, like the lens of the eyes, causing blood vision. How? Because this glucose are not moved into the muscle cells that needs them to function, to have energy to function in our daily activities. The body tries to devise an alternative means of releasing energy, thereby burning fat, converting fat in the body into energy. This in return causes weight loss and what we call diabetic ketoacidosis. The body becomes so acidic. Now, the good thing about type 1 diabetes treatment is that once the individual has, been diagnosed that, oh, you have type 1 diabetes mellitus, and they start adhering to their insulin regimen treatment, these signs and symptoms can be reversed, although the condition itself cannot be reversed because they can never produce insulin. So they have to depend on the insulin injection that they take, which mimics the natural insulin that the body releases. Now let's go to type 2 diabetes mellitus. In type 2 diabetes mellitus, two things happened. This type 2 diabetes mellitus is usually, caused by lifestyle, our lifestyle, mostly. So now what happens is the body produces insulin, but it's either the insulin that the body produces is not enough to regulate the blood glucose level, or the insulin is unable to move the blood glucose into the muscle cells that needs them. Now, when an individual with undiagnosed type 2 diabetes consumes food that is high in carbohydrates, of course, it passes through the normal digestive processes, and glucose is released into the bloodstream. The body detects normally that the blood glucose level is risen and then stimulate the pancreas to release insulin. Insulin, moves alongside with the glucose and gets to the muscle cell. But this time, the doors of the muscle cells is being clogged by fats, especially like in an obese individual. The glucose is unable to move and the insulin is unable to unlock. Now the blood glucose keeps rising. The body keeps stimulating the pancreas to release even more insulin, and this even complicates the issue. Now the blood glucose is on the high side and insulin is also on the high side. This keeps happening until the body becomes worn out. Of course, the signs and symptoms of type 1 and type 2 diabetes mellitus is similar, because the body now tries to have an alternative means of eliminating this excess glucose in the blood through the kidney, and the person urinates a lot, although not all of them. The person have delayed wound healing because of the blood glucose sugar. Also, this individual have blood vision and etc. Now, one tricky thing about the type 2 diabetes, the signs and symptoms, is that it does not manifest in most people with type 2 diabetes mellitus, which is why so many people live with type 2 diabetes mellitus for over 10 years before they realize that they have type 2 diabetes mellitus, which is the reason you need to watch my next video, because I'm going to share with you some of the diagnostic tests that you need to do in order for you to know if you have diabetes mellitus. Especially type 2 is the most common because of our lifestyle, and this type 2 diabetes mellitus is mostly managed with dieting and exercise. Please comment any topic that you want us to discuss, and also share with your family and friends this video. You will never know who might need it. Thank you. I still remain your dynamic nurse. See you in my next video. Bye.
To watch more, subscribe.